Because it can be a very serious injury, you asked us what is known about the occurrence of concussion among high school athletes while playing or practicing competitive sports, and about activities addressing the issue. In terms of the first question, the frequency of occurrence, we found that the available information cannot provide an overall national estimate of how often concussion occurs, and that, moreover, the figures that are available likely underestimate the magnitude. We identified 3 sources of information that each capture one piece of the story. For example, a database at the Nationwide Children's Hospital in Columbus, Ohio, monitors the occurrence of injuries, including concussion, at a sample of 100 high schools. But the figures they've published from that database only cover 9 sports, not all sports. Another database we identified is sponsored by the Consumer Product Safety Commission, and that captures information from people who present with injuries at emergency rooms. But not everybody with a suspected concussion goes to an emergency room. It's not that the numbers are wrong, it's just that it's not the full picture. And although it's useful to know how often concussion occurs among high school athletes, the goal isn't to get a perfect number. After all, if you're a parent and it's your child, there's really only one number that counts. The other part of the issue is what to do when it happens, and we found activities targeted to this issue at both national and state levels. At the federal level, the Centers for Disease Control and Prevention in the Department of Health and Human Services sponsors the primary educational initiative that is specifically directed at preventing concussion in high school sports. And you heard it referenced before. It's called Heads Up Concussion in High School Sports. It provides educational materials for coaches, athletic trainers and directors, parents, and athletes. The program was initially rolled out in 2005, and the agency continues to update the materials. At the state level, 3 states were identified to us as being key in terms of having passed legislation specific to concussion management in school sports: Oregon, Texas, and Washington. All 3 state laws contain provisions regarding concussion education and also provisions regarding how quickly athletes can return to play after a suspected concussion, although the laws do vary. For example, in terms of concussion education, Oregon targets the coaches, Washington targets the coaches, athletes, and parents, and Texas targets coaches, trainers, physicians who work with the teams, athletes, and directors of the marching band. All 3 states require that an athlete returning to play be cleared in writing by some type of health professional. We also identified 5 sets of voluntary guidelines that covered nationwide guidelines that address the management of concussion in sports. All 5 guidelines are similar in that they recommend an athlete with a suspected concussion be monitored on the sidelines and return to play gradually. Only one of the guidelines, that from the National Federation of State High School Associations, specifically targets high school sports. And that guideline recommends a gradual increase in both physical and mental activity. So for example, the athlete may be on an abbreviated school day, progress to a full school day, and then increasingly engage in physical activity. When we looked at these various activities across CDC, the state laws, the guidelines, I personally was struck by how many people have the potential to observe the effects of a concussion in a high school athlete, as the graphic illustrates. Certainly the coaches and trainers are there, but so are the teammates, the parents, the teachers who may notice something a day after an injury, the school nurse, the family physician, the emergency room physician who may examine the athlete. There's lots of people around these kids, and everybody has an opportunity to contribute to making competitive sports as safe as they can be. I'll be happy to answer any questions you may have. Thank you very much.